Hi, good afternoon.
Hello, Aastha, welcome.
Uh,
So we'll wait for a couple of minutes for people to join in.
yeah, we can start basics.
Okay, so we have already 12. So I'll do a formal welcome to Dr. Aastha Mehta. Dr. Aastha Mehta has been associated with us for a very long time, and I have known her even before she got into medicine, and her family too. So she is a gynecologist and a fetal medicine expert. She also is an expert into sonography of the fetal sonography. And we are going to uh, discuss about the very common PCOS disorder that we commonly encounter almost every day in our family, in our friends, and for doctor friends, we can see them in our clinic every day. So, so should I shoot, Dr. Aastha?
Yes, absolutely.
So, tell us what is this whole idea called the polycystic ovarian syndrome or polycystic ovarian disease?
So basically, we cannot call it to be a disease. It's more or less like a lifestyle change, or I would say a disorder, because it purely based on the lifestyle changes that have been occurring in the new generation in the so that is it is completely lifestyle disease that we call it. um, Normally it is around the 6 to 13% of all the reproductive women, uh, and yes, and around 50% of the South Asian population is undergoing problem. Even in our OPD, we normally, if we have around 20 patients, then we have at least 5 of them with PCOS, maybe young adolescent girls, or even very old ladies, like first child they are naturally conceived, and even for second pregnancy they are having PCOS. So it is a very rampant thing nowadays, and
And
it
you
is
mean to
completely.
say that it is practically 1 in every 2 women of the reproductive age in the whole of Southeast Asia? Is
It
that
is it
the
Yes, as
prevalence?
yes, absolutely.
And that
It
is
is
almost epidemic.
we have been reading and reading. So many new things are just coming up nowadays regarding PCOS. Um,
So how do
new medicine.
so how do we understand this very wide spectrum? Normally, what we see in the clinics is young girls who will come with
Yes.
uh, they will come with delayed periods or scanty periods. So, and then you also mentioned that women post their first pregnancy, first delivery also
Yes.
then have this disease. Can you
Yes.
just throw some light on this?
So basically, there are many phenotypes in PCOS. I would say many categories. There are mainly four common symptoms which occur. Number one is what we term is as oligoanovulation. That means irregular scanty periods. That is the main complaint. The second is sudden increase in weight gain, like almost 5 kg in 2 months, 3 months. That is what people come to us for. Number three is increased male type of hair growth over the limbs or hands, or then there is something which is called darkening of skin over the back area, over the neck, and that is called acanthosis nigricans. Number five is alopecia. That means thinning of the hair. It is like completely male type of baldness that we call it as. So there are so many symptoms that people, and the main thing is obesity. So people are
Okay.
coming with increased weight gain. So that is how we, even with the primary history, we can make it out that, these people might be having PCOS.
So this obesity can be a symptom of the whole disorder, or it is the cause for the whole disorder?
So
How does this work?
it really works synergistically. It's because if the patients are having PCOS, they tend to become obese because of scanty irregular periods and vice versa. So that is why we always tell them that the first thing to do is just lose weight.
Okay. Okay. And what you also mentioned about a male pattern of hair distribution, male pattern of hair loss. Can you tell a little bit about this and what this has got to do with this whole complex called PCOS?
So hyperandrogenism is one of the features for PCOS. There is a whole classification. We don't want to go into that detail, but yeah, they have and the male type of baldness is it's called fronto-occipitotemporal baldness that then leads to thinning of hair. Hirsutism is what is called a male type of hair growth. It is because of the hormones which is called as testosterone. That is a male hormone which is normally present in every female in a certain
Level.
a certain level. Yeah, but
Yes.
so the one investigation which is called total testosterone. That is one investigation which is very commonly used in India for patients to rule out hyperandrogenism. Yes.
Okay. So basically, when you're talking of fronto-occipital baldness or loss of hair, it is basically, it
Yes.
is
Yes.
right in the front of your forehead, the top of the head, and the back of the head, where the hair is thinned out, or there is an actual loss of hair.
No, there are even thinning, and few of them here. Mostly, I have when patients they have mostly frontal. Yes, the loss of hair
Okay.
is the
Right in the front, right? So what we normally see in men, usually what we call the middle-aged men, you would
yes.
normally see there is a hair loss beginning from the front of the hair and receding hairline, right? That is what we mean by a male pattern baldness that is coming up.
And when we talk about obesity, the waist to hip circumference is very important as a marker. They have a
Okay.
typical android type of pelvis. I mean, the structure, it's like an apple. That is how it
Okay.
is. Waist to hip circumference ratio is always more than 0.8. That is what we call it in our terminology.
Okay. So basically, if I can understand, the obesity, the fat distribution is more on the hips and the lower end of the body,
Yes.
below the waist, right? That is why this
It is called as
circumference
apple.
of the,
Yes.
yes, the apple shaped
Shaped.
obesity.
Yes.
Because every hormonal disease, what we call as endocrine disease, would have its own way of distribution of the fat. So this is very, very important factor which can alert us that this is a problem. This could be a possible problem there. And that is why this waist and hip ratio, the circumference ratio, becomes abnormal. Yes, yes, yes. And also, many times we do encounter women who are not obese,
Yes.
and they also are diagnosed with a PCOS.
Yes. So
How do you
they
understand
are
this?
called as lean PCOS patients. Around 5 to 10% of the PCOD patients do come into the category of lean PCOS. They have a BMI of less than 23. They have a typical. They also have an increased abdominal obesity.
Okay. So again, the fat distribution is around the tummy, the abdomen.
Exactly.
Right?
Exactly. And
Okay.
early irregular periods.
Okay.
But
And they
that
also,
sorry.
sorry, go on.
That all the PCOD patients, they have a different variety of distributions. I mean, not all of them have hyperandrogenism, not all of them have chronic anovulation. So they are classified into 4 different categories.
Okay.
So they are called as from phenotype A, B, C, and D. So, yeah.
So how do we understand what is the phenotype, for especially for people who are not doctors and who are attending this? How do you understand what does the term phenotype actually mean?
So phenotype is the categories. Now, if you can say for phenotype A, now those patients have 3 symptoms. One is chronic anovulation, that is irregular scanty periods, increased male pattern of hair growth, and polycystic ovaries on sonographic appearance. That goes into classification. Yes. Number 2 is increased hair pattern, that is hyperandrogenism, along with chronic anovulation, that is scanty periods. They do not have polycystic appearance.
Okay.
The phenotype C, hyperandrogenism, and
so each time when you mention hyperandrogenism, it is actually a condensed form saying that it is more of the male hormone circulating and the symptoms because of the male hormone that are present,
yes,
right?
Yes. So, and the category C has that along with sonographic features. And category 4 does not have any symptoms of hirsutism, that is increased male growth. It only has a sonographic picture of polycystic ovaries and the scanty irregular periods. So that is phenotype D.
Right. So as we can put it in a nutshell, is if phenotype is basically a physical appearance.
Yes.
More than anything to do with your genetic structure.
Yes.
Right? Do I understand this right?
Yes, absolutely.
So usually they are obese, but there can be a class of PCOS patients who are not obese, they are lean,
yes.
but they can have an abdominal girth where the fat is deposited in the abdomen. Right?
Yes.
Now, while you are mentioning this classification, these different types, does it have any implications in terms of understanding and the treatment if we classify or if we don't classify our patients?
So normally, there are many ways to diagnose PCOS. For example, if we segregate into adolescent PCO, adolescent is because nowadays one of the main factors, or I would say causes of PCO, are even young girls have starting periods less than the age of 10. So early menarche can also be one of the factor.
Okay.
Along with stress and anxiety are major factors which are accumulating, and I would say they lead to PCOS. These are some genetic things which we see normally. As far as adolescent PCO, there are young girls coming at the age of 13, 14 coming to us for irregular. So normally we say that when you start your periods, for at least 2 years down the line, we don't have to monitor anything. And sonography is not to be done at least around 8 years till you start your periods, because that is not the time when you can actually diagnose PCOS.
Right. So this is a very, very valid point, and I would like to stress this point to all our audience here, that very often young adolescent girl, you'll see, now I see in my clinic also 13-year-old, 14-year-old being brought, said, okay, when periods are not regular and sonography is done, and then a diagnosis label has been put. So this is very, very important that we don't diagnose, don't label anybody with PCOS before the age of 18 years, right, Dr. Aastha?
Absolutely. I would not recommend at all. We would just tell the mothers to just wait and wait, just lifestyle changes and exercise. That is the only thing we tell them to do.
Right. So I think then you bring two very important aspects that are closely related to this disease. One is the mental health aspect, and the second aspect is the food that we eat and the exercise that we do, the lifestyle that we live. They kind of contribute to this whole pseudo PCOS kind of disease before the age of 18.
Yes, absolutely. Every time we ask any female, any young girl coming to us, they are just they are complaining. The two main complaints is that eating junk food, number one, and number two is just lack of exercise because they are stressed out due to work, due to competition, I would say, and yes, they just and sudden rise of weight. That is what they always say. This is out of the book, I would say. They always tell us that within 3 months she's gained 5 kg, 6 kg weight.
Okay. So in a situation like this where there is a weight gain, one would also think of PCOS, and also very commonly we also think of a thyroid disorder when there is an increase in
Yes.
sudden increase in weight.
So if so,
Right? So
differential
yes,
diagnosis for this, we can even we have to correlate with thyroid. Even scanty periods can also be related to low hemoglobin. Even irregular periods can be one of the factors, causes for hyperprolactinemia. So not necessary that we have to just jump onto PCOS.
exactly. So that is one point that I would like to bring forth to the audience, that PCOS is one diagnosis that needs to be put or arrived at only after other disorders are ruled out. Right?
Absolutely.
So,
Absolutely.
Dr. Arthur, very often I see patients, who have been brought to me by even by senior doctors who have been diagnosed, because on the sonography they will say, okay, polycystic ovarian like appearance is there. So how authentic do we consider that this is called as polycystic ovaries? Because just on the sonography we see this cystic ovarian ovaries are there.
So there are specific sonographic findings that we see. So it is either of one of the ovary having more than 12 follicles, each of around 2 to 9 mm of size, is one diagnosis. The other is total number of follicles per ovary more than 20 is also one of the diagnoses. And the third is the total ovarian volume per ovary has to be more than 10 ml. That these
Okay.
are the ultrasonographic criteria that we follow.
For a possible PCOS,
Here,
right? So,
increased
for
total.
example, yeah, for example, we find that the TSH levels are high, and also we have this polycystic ovarian-like appearance on the sonography. Then, would you diagnose this as a PCOS situation?
So it depends on the other factors too. But once if the patient has thyroid, we correct that, and then we go on to the PCOS, because if we find the proper ultrasonographic finding along with irregular scanty bleeding, along with obesity, then yes, definitely there can be two things together too.
But would it not be that most of the times, if we correct the thyroid problem, the hypothyroidism, very
Yeah.
likely this issues also will get resolved?
So, well, I would say that once we correct thyroid, see, thyroid, if the patient is hypothyroid, then patient mostly can have menorrhagia. That never happens in PCOS patients. They have irregular scanty bleeding. So we have to see all the other factors along with the other blood investigations too, like what we do on day 2, that is follicle stimulating hormone, luteinizing hormone, AMH levels, of insulin, fasting plasma insulin. So these are also few factors.
Okay.
Along with other blood investigations, we can come to some conclusion.
Okay. Okay. So you mentioned about menorrhagia. Menorrhagia would be profuse menses, which is
Yeah.
exactly opposite to what we see in PCOS.
Yes.
And when you have hypothyroidism, normally you will have profuse menses that is the presenting symptom
Yes.
of the right. And you interestingly also mentioned about insulin levels in PCOS. What is this? We always understand insulin in connection with diabetes. Now, what has this got to do with a polycystic ovary?
So polycystic ovarian ladies, pregnant females, or I would say uh, after the age of 20-25, normally we always tell them that we normally check the insulin levels, because there is a lot of insulin resistance that happens in PCOS,
Okay.
and that is also one of the factors for increased male pattern hair growth and obesity. So there are many insulin sensitizers, is what we call, is the drugs which lower the insulin, blood glucose levels. That can also be one of the factors to reduce weight as well as regularize your periods.
Yeah. So when we are talking about insulin resistance and insulin sensitizer, we are basically talking about a situation where the body is producing insulin in the blood, but the insulin is not able to do its function of bringing down the blood sugar, of bringing down the weight, right?
Yes.
Is that what we
Yes.
understand by
Yes.
insulin resistance? Right. So what is the way out to treat? Because we find this insulin resistance also associated with type 2 diabetes. We also find that insulin resistance associated with heart disease and cholesterol issues. So this seems to be a very, very central problem also to many of the lifestyle disorders. So how do you see a way out to handle this insulin resistance problem?
So there are many insulin sensitizers, as I have told. In terms, if you so there are things which there are diet and there are other medical strategies that we implement. So this is lifestyle change. Is normally in treatment, medicines always play a second role. Primarily, it is just the lifestyle modification that we tell them to do. Initially, we tell them to at least do brisk walking or brisk exercises, jogging, swimming, around 30 minutes a day, or total 150 minutes per 5 days a week. They
So 30 minutes for 5 days, or you do a little extended more, and maybe you can go down to maybe 4 days in a
yes,
week.
4 to 5 days a week. Yes. That is so exercise, yoga, meditation because to reduce your stress levels, to reduce anxiety. Diet, as far as diet is concerned, we normally prefer monounsaturated fats, that I would like to say more of protein, around 20% more protein diet. Yes, and good carbohydrates.
So
And
what is a good carbohydrate, and what is the
sweet potatoes can also be eaten in PCOS, but they are good carbohydrates that we need to eat. Proteins, all fruits mostly, pear, apple, guava, berries like cranberries, blueberries, raspberries, even many seeds like pumpkin seeds, flax seeds, sunflower, sesame seeds. They
right?
are also very, they are very good in this. Even ghee. Normally, we even tell them to have ghee early morning, empty stomach. Yeah.
Okay. So wouldn't ghee increase the cholesterol levels, and
No,
how
not
do
really.
you balance out these two things?
No. They will not do that. So, I mean, this is our PCOS diet that we normally follow. Even we tell them that there is something which is called a plate partition method, that at least your plate should have more proteins and less carbohydrates and fats.
Okay. So in a typical Gujarati or a vegetarian diet, we normally find that there is lot of carbohydrates and very
Yes.
little of protein.
Yes.
So how does one kind of increase the proteins in the plate?
So normally we tell them to eat more of grains. I mean sprouts. One sprout per day. Normally, even avocado, even I would say drumsticks. They are also having good fiber. Increased fiber diet is also very essential.
And I think inclusion of nuts
Yes,
would also
nuts, all
increase the
seeds.
protein
Yes,
intake. Yes.
almonds decrease insulin. So decrease your glucose level.
Yes. So I think it is very important that all the audience get to know that while medical therapy, whether it is modern medicine, whether it is homeopathy, the root cause of an abnormal, unhealthy lifestyle will need to be tackled before any of the medical therapies, if at all required, or if that has to be successful.
Absolutely. I would always focus a lot on diet to my patients initially rather than giving the medical therapy. Yes, insulin sensitizers are like metformin are very good for PCOS patients, but as far as contraceptive pills are concerned, I would not prefer much to the patients unless it is really.
Yes. So here also I have found in my experience in patients who have followed a good regimented diet and lifestyle, homeopathic drugs, considering the whole constitution, considering the mental state of the patient, have been extremely valuable in treating, in reversing this condition to a very large extent. Dr. Aastha, do you have any experience with a dairy-free diet, and if that has been helpful in these patients?
So, as you have always suggested, that dairy-free products are very essential. So now you can consume milk, and so cow milk and almond milk is preferred, and milk and milk products like they can be only taken in a certain amount, but not to be overdone. And coconut milk, almond milk, they are also good substitutes to our regular milk, which can also be used in PCOS.
Yes, so I think because a lot of us will look for an alternative to the dairy milk. So all these nuts, almond milk, cashew milk, oat milk, and coconut milk are very, very good and viable options which can be used on daily basis. So would even suggest all of you all to try this out at your home for your patients, for your relatives, and I'm sure it will help them a lot.
Absolutely. Even few, they are very empirical, not much proven though, but vitamins like vitamin E, D-chiroinositol, myoinositol, there are also few other drugs and even probiotics. They are also used as other supplements for PCOS along with the contraceptive pills and the insulin sensitizers like metformin.
So there is a possible role of these probiotics and other supplements in reversing this disorder. And there was one question from a participant where she has asked, is PCOS from menarche, or it can also develop later on in life?
No, it can.
This is a very, very interesting question.
Which I had already mentioned, that many people do come with secondary infertility, meaning that they cannot conceive the second time, and when they are diagnosed as PCOS. So yes, definitely. And even after first delivery, sometimes, so early conception and early pregnancy is also one of the I would say treatment for PCOS.
Okay, but how do you understand the cause that in patients who develop PCOS later on after their first pregnancy? What would be the reason behind it?
So I think same goes that way. I think it is related to the lifestyle, probably stress, anxiety. Yes, and because every time the patient comes in, every secondary infertility patient with PCOS also do complain of obesity and increased weight gain.
Okay. So here we are basically dealing not with the ovaries as a problem, but we are basically dealing with a whole system, starting right from your mind down to the heart and everything.
Everything, yes.
So it's the name. Therefore, it is a syndrome. Therefore, it's a disorder. It's not just related to your ovaries, but we are dealing with the whole health. And therefore,
because developing diabetes in pregnancy, they are very common complications, stroke, heart diseases, so many things happening, increased cholesterol.
Yes.
With people. So in a nutshell, it is very important to lose weight.
Yes, and I believe that PCOS is making you prone to develop other lifestyle diseases. So I always tell my students that one lifestyle disease is basically, they are like a bunch of thieves. If one gets in, then they kind of invite the other to join into the gang and have a party in your body. So important that we come back to a healthy lifestyle, exercise there has to be good amount of exercise this body needs than just sitting around and watching media and doing everything on the fingertips. So any other important points, Dr. Aastha, you would like to bring forth to the notice of our audience about this disorder?
So I would always, not my book, I would always tell number one, wait. Number two is to consult a dietitian, and definitely try and regularize your lifestyle, doing exercise at least minimum 30 to 40 minutes a day, as I have told you. There are also studies saying that even Surya Namaskar, doing Surya Namaskar even 5 to 6 per day can also have implications on PCOS. And I think homeopathy, being an allopathic doctor, I would always even recommend homeopathy for this disorder, yes.
Yes, so that has been our experience also, where homeopathy has been of big help to these patients. But again, I would like to stress upon the point of correcting your lifestyle is very, very important.
Yes,
It is the
absolutely.
first primary requirement for any further treatment if it has to be successful.
Yes.
So I believe that we have covered the disease in quite a bit of details. Some very interesting points have also come up for me also to learn. We would invite questions from the audience. If you have questions for Dr. Aastha, she's still here. We have another 5 minutes more where you can please put in your questions. We are happy to take the question. Insulin related, explain more simple terms. Okay. Mr. Umesh Chaurasia talks about explain this idea of insulin resistance in connection with PCOS in a little more easier way for them to understand.
So our body has fat, and increased weight or increased obesity or increased deposit can lead to insulin resistance. That it does not allow. So in the other way, it can lead to increased blood sugar levels in a simpler way because of PCOS, and that can lead to diabetes in the long run.
So I will just add a little bit to this, that insulin resistance, moment insulin stops working, though it is produced in the blood but doesn't work on the fat cell, it also creates a snowballing effect on the other hormones in the system. And one of the impact of this insulin resistance is PCOS. So there are a whole orchestra of hormones that get involved the moment insulin starts behaving abnormally.
True.
So another question, yes.
Profuse and prolonged after amenorrhea of few months in PCOS. Yes, you can. So if there's something which is called endometrial hyperplasia, that means that the skin has been collected inside the uterus, and then after a few months, it can just lead to sudden increased blood flow.
Right.
But
So basically,
yes.
when you're referring to endometrial hyperplasia, we are referring to thickening of the endometrium, which has been not shed off like it happens in the regular menstrual cycle.
Someone has asked, is PCOS treatable or manageable only? Yes, it is not treatable, definitely, but yes, it can be managed. And it really needs to be managed, because seeing the scenario nowadays, it is every second, third patient is coming up with PCOS, from young girls to adults. And
so the whole
definitely
idea, as I understand this question, because this issue also one asks for diabetes also, and one will also ask for heart diseases also and hypertension also. See, when a problem fundamentally is rooted into a faulty lifestyle, then moment your lifestyle goes off the track, the medicines also start becoming jittery in their action. So one will have to make sure that you live a correct life. What is good for your body? Eat what is good for your body, and do the exercise that is required for maintaining this body. That is the fundamental aspect. Okay, another question. Facial hair, which is come due to PCOS. If we treat PCOS of patient free of, but the hair will still sometimes remain. So they're talking about hirsutism. Yes, Dr. Aastha, what has been your experience with this?
So normally increased pattern of hair growth over the upper lips, side locks, between the breast, near in the armpits area, even the blackening of skin. So this happens in patients with PCOS. So normally there are many cosmetic surgeries. I mean, I would say cosmetic therapies also, which are coming on in for like laser hair removal treatments for patients having increased hair growth. And there are medicines, anti-androgenic, I would say, I mean, something which reduces the testosterone hormones, which can also be used in patients with PCOS.
Yes. So, but how easily do you recommend this? And the question is a little different.
Not much, but when we give pills which contain namely cyproterone acetate, or so that along with estrogen, that can decrease the testosterone levels to a bit. Yes.
So what is important is again focusing on the centerpiece of this disorder rather than looking at the other aspects as very individual phenomena. Okay. Any other questions? Please feel free to ask. We still have another 4-5 minutes before we wind up this session.
Please do tell me about your experience, Munjal sir.
Yeah, so my experience, like I said, that issue. Okay, let's take up one question. Is it common to have profuse and prolonged menses after amenorrhea? Okay, we have taken up that, right? A few months of PCOS. Yes, Dr. Digma, yes, it does happen that way because the hyperplastic endometrium, when it is shed, it is of course going to bleed more than what normally it would bleed. So, okay, so my experience with homeopathy has, like I have said, that first fundamental requirement for a very successful treatment is definitely lifestyle change, no doubt about that. But there are a very small percentage of young PCOS patients who refuse to make changes in their lifestyle, but I have seen good results in such patients, but they are more of an exception rather than a rule. But I believe in those patients, one, they would be the one before 18, young girls,
Yes.
and also those who would be stressed emotionally and mentally, where homeopathy helps a lot to take care of this stress aspect and the bodily aspects, bodily symptoms arising out of stress. So they are more of an exception than a rule, where in spite of no change in lifestyle, patients have responded to the homeopathic treatment. So that has been my experience, and I see absolutely day in and day out patients with PCOS.
Yes. Absolutely.
Okay, so we have time to take 2 more questions, or Dr. Aastha, you want to say some?
No, just which is even called cognitive behavioral therapy, that people do even consult psychologists and undergo behavioral therapy for PCOS, because many of them do undergo depression.
Yes. So there are, so a emotional issue, stress can lead to PCOS, and a persistent PCOS can lead to even emotional issues in a young women of reproductive age.
Anxiety is nowadays considered to be the most important factor for PCOS.
So we are moving into an age where we are dealing with a lot of mental health related physical disorders.
Absolutely.
In fact, a faulty lifestyle also arises very often because we are so stressed. And it's not just one person who is stressed. I believe the whole population is so stressed.
It is undergoing the same.
We go on eating fast food. We all get a bunch of friends, get together, and we have a party where we have cakes. And well, I have nothing against cakes, but the point is we eat to such an extent where it goes on to harm us. So we are facing a very collective phenomenon, and we will all have to gear up to work collectively and advising our patients and also our relatives to come back to the right lifestyle.
Absolutely.
Right. So, Dr. Aastha, thank you so much for being here, enlightening us for this very, very important topic. And it has been great talking to you. And we will again call you back for a part 2 session with other gynecological problems and fertility issues,
Sure.
since those are your specialty.
Yes. The infertility rate has also really gone up
Yes.
because of PCOS, late marriages, stress. So yes.
Okay, so take care and goodbye, all of you. We'll come back again next week, in the next few weeks, with Dr. Aastha again here. Do share in your comments, do like the video, and share with your friends and family. Subscribe to our channels. Take care and bye.
Thank you so much. Bye bye.